Hello everyone, Namaskar and welcome to Apollo 24/7's Health Hour. This is a show which is a live show where we bring experts from Apollo hospitals and you can ask all your questions and queries. We shall bring answers to them. And you must be watching this on Instagram, Facebook and YouTube. If you want your query to be answered, I request you to please come onto YouTube. This is Apollo 24/7's YouTube channel where you can type your query on the YouTube chat and I shall take this up with the expert today. Also on the show, we do give out gift vouchers and discount vouchers towards the end of the show, and also there's an opportunity for you all to win prizes from a quiz that I conduct. This is health quiz towards the end of the show. So if you want to participate in that as well, please hop onto YouTube chat. Day before yesterday, that is 15th of March, is observed as the World Sleep Day. As world is moving really fast-paced, we are cutting down our sleep times shorter and shorter, and how is it affecting us? We thought we should speak about this. How to sleep faster and better, what are the sleep disorders and how are they manifesting as diseases in our lifestyle, through our lifestyle. So today we have Dr. A.C.Somasundaram, who's our senior consultant neurologist at Apollo Hospitals, Greens Road, Chennai. And you can consult him on Apollo 24/7 as well. But today we are bringing him live to you, and Sir's experienced with more than 15 years. He's a senior consultant neurologist at Apollo Greens Road, Chennai, and he can be consulted for headache, stroke, epilepsy, Parkinson's, dementia, insomnia, and other neurological disorders as well. He is a member in American Academy of Neurology since 2014, member in Indian Academy of Neurology since 2014. Indian Epilepsy Association, he's a life member there, and Association of Physicians of India, he's a life member. Movement Disorder Society of India as well, he's a member, and he's awarded amply. University medalist in DN Neurology. He received gold medal in pediatrics during the final year of MBBS, and he has received international Elsevier Atlas Award for co-authoring a review article titled Application of Mobile Phones in Epilepsy Care in the International Journal of Epilepsy in June 2015. Let me welcome Dr. A.C. Somasundaram. Good morning, sir. Welcome to the show.
Good morning, and vanakkam, namaste, and namaskaram to everybody. It is a pleasure to always join with you.
Wonderful, sir. So, Dr. Somasundaram, you are a very well-known neurologist, and we understand that brain is something that creates us, the entire personality. The world is moving absolutely at a faster pace. We now have reached a time where we don't want to give more time to sleep. Let's talk about everything related to sleep. What is sleep? First, let's start with that basic question. What is sleep?
No, sleep is a very fundamental function as well as a fundamental requirement for the brain and mind to function properly. So there are several people who think that sleep is a wastage of time, but it is otherwise. If you don't sleep, the quality of your cognition is not going to be up to mark. Especially in our lives, we are all in a very demanding job, mentally and like emotionally demanding job. Without proper sleep, I don't think any of us will have. We may have a lot of quantity of awake time, but the quality will be very less. So we will not be able to sustain that for a long time. So sleep is an absolute important part of our day-to-day life.
Right. So while we say that sleep is very important, what happens if we don't sleep well?
So the very basic function of the brain is sleep. So without sleep, the first and foremost structure that gets affected is the brain. Obviously, the brain, your cognition, your attention span. That we see even in people who drive. We see people who don't have. In fact, if you don't sleep well, you are not allowed to drive. There are laws in several countries.
Yes,
also.
in many countries.
Especially if you're a pilot, you should log in a specific sleep time before you are assigned your task. So that itself tells you the importance of sleep. Your attention slips away, your concentration slips away, and brain is an organ which will not be like merciful. You have not slept for one entire day. You are driving a Boeing 777 jet, and it doesn't care what you're doing. It will take its sleep when it wants. So that is what happens most of the time, even in people who are involved in heavy vehicles and all. Even if in the most precarious of situations, The brain can only tolerate up to a certain limit. Irrespective of where you are, the brain will take its sleep at the most inappropriate of times. So it is better to give the sleep to the brain at the appropriate time, or else we risk it taking it away from us at the most inappropriate of times.
Very well put, Doctor. Very simply, it's so simple to understand. But then we are not understanding the simple logic. That's the problem.
Mm.
And we think that that's enough. It must be the lifestyle. It could be, any work-related activity or students who are practicing in the nights, travel-related jobs. All these are causing, reducing the sleep time, and good quality sleep time is being affected. So, what do you have to say about the lifestyle changes that we have come to?
No, one thing that we have to understand, like this is a little bit off topic, but it is very important for us to understand why it is not possible for us to sleep whenever we want. Because sleep is, as I said, it is a function of the brain, and everything that we have in the brain, we can control it with consciousness. Right? We are all consciously aware beings, but why is it that we are not able to? We can control at what time we go to bed, but nobody can control at what time we fall asleep. Why is that? That is a very fundamental
Yeah.
question that everybody needs to understand. Like some people go to bed at 9 o'clock, they sleep at 9:15. Some people go to bed at 9 o'clock, they sleep at 3 a.m. So why is that happening? Why are we not able to control why we are not able to fall asleep? So that basic question, like for us to understand, it requires a little bit of history of our evolution also. Like human beings, I'll finish it a little bit fast, so I don't want to take a lot of time on this. But
No
it is very
problem. So,
important
please,
for us
it's
to
very
understand.
important to understand.
Yeah. So human beings as species, as human beings have been on this planet for 200,000 years. 200,000 years we have been on this planet, and these technological advancements that we have, that this fast-paced life, this internet, all our professions, software engineering, and flying a flight, and these sorts of professions, technologically demanding professions that almost everybody is involved in now, has been there hardly for the past 200 years, which is just a blink of an eye when it compares to human when you compare it to human evolution. So even though brain is a single organ, what we have to understand is there is always a dichotomy in the brain. There is a primitive part of the brain which has been there with us, which has been taking us through the past 200,000 years, and which has made us survive to reach this point of time. And there is a more technologically advanced younger part of the brain, what we call as the neocortex. It knows when we should sleep for us to attend exams tomorrow, when I should sleep now for me to attend the important interview tomorrow. It knows that. But the primitive brain doesn't know that. Primitive brain has been there for the
Oh,
past 2 lakh years. It is like you consider an analogy where there is a house where there is a 90-year-old person and another 15-year-old person. Obviously, the 90-year-old person controls all the assets. 99% of what happens to the assets, what time the things happen at the house, it is controlled by that primitive person, by that primitive part of the brain. It's like a younger person having an argument with an older person. No, I have an interview tomorrow. Please sleep. The younger person tells the older person. But the older person says, there is light. See, there is light. The light is there, and the light means daytime. For the past 99% of my life, during daytime, if I sleep tomorrow, there will be no food for me to eat. Go and hunt. Don't be lazy. If you don't hunt for food now, tomorrow we are going to die out of starvation. Don't sleep now. You are a lazy person. But the young person says, Arey Baba, that part of life is over. We are all out of caves now. Tomorrow I have an interview. But the old person doesn't understand. He has been there for 2 lakh years, you have to remember. This person has been there for the past 200 years. Obviously, you know who's going to win the argument. As far as he is concerned, whenever there is light, whether it is from your mobile phone or from your laptop or from your light, he'll think that it is daytime. It is time to go and hunt for food. So he will not allow you to sleep when there is light. And when there are social interactions, unfortunately, the primitive brain is the one who controls all the assets. What is your heart rate? What is your blood pressure? How much urine your kidney produces? How much bowel movements you have? All these functions are controlled by the primitive part of the brain, which is yet to catch up. And it will catch up. It will take a long time. It will take at least 20 or 30 generations. But it will not be as good as the newer part of the brain. Younger person will always understand things easier. So it is better for us to trick the primitive brain and think and not go against it. If it is dark, it will sleep. If you use your mobile phone or laptop or computer, it doesn't know that the light is coming from the computer. It will always think that it is daytime. Obviously, daytime, you go to sleep, next 1 week you have to starve. Obviously, it still thinks that we are in caves. We have been in cave for 99% of our history, and only in the past few years
Very,
the food is so abundant and things like that. And similarly, also one more
very
important thing,
beautifully explained, doctor. I think this is
yeah,
one very, very important factor that all of us have to understand, that within
yes,
our own system we are fighting with two or three
mm,
different kinds of systems which are not yet updated.
yes. And the one more important thing is like what we call as these are all circadian clues that our body has, whether it is day or night time, and doing a lot of social interactions. Like the new part of the brain understands that we have Facebook, Instagram, you can do it even in the night time. But whenever there are social interactions, the primitive brain thinks that it is daytime because it used to have
Okay.
social interactions only during the daytime. It will not allow you to sleep when you're using Facebook and Instagram and WhatsApp. It will think that you are talking to some people in the daytime. It will not allow you to sleep. So please avoid doing these things in the night time to trick your primitive brain to think that it is the right time to sleep. And one more thing, eating.
Oh God.
Never ever eat.
So,
Never ever
this
eat
is it.
anything beyond 7.
Reiterate,
Yes.
let us reiterate the two important points, because I see a lot of people are still joining us now. Till now, Dr. A.C.
Mhm.
Somasundaram Garu has explained that first one, the primitive brain things is the light, which is a challenge, it will not let you sleep. Second one is a
Mhm.
social interaction. Any form of social media, if you're talking or texting or watching something, it will think that
Mhm.
you are talking to somebody, it is controlling you neurologically to keep you
Mhm.
awake. And the third one that is very important, sir, is coming to, and let's listen to him.
The third important point is eating food. We are used to eating food only during the daytime. When you have a midnight snack or things like that, the brain will once again think that there is food. This person has hunted and found some food. It obviously should be daytime. It will not think that it has eaten from the fridge which has been ordered through Swiggy. That advanced part of the brain that understands. But the primitive brain, which still thinks that we are in caves, we are still struggling for food, doesn't understand these things, and that is unfortunately the one who decides when you go to sleep, when you get your sleep.
Hmm. Right. So it's a very, very important factors, that three important factors that you've highlighted. So other
Mm,
than these three, I think I'm seeing the messages that are coming up on the chat,
mm,
YouTube chat
mm,
here. So the other factors which could influence, other than the social lifestyle factors, could be pain, could be
mm.
other neurological or mental health kind of related. So let's start taking questions. The first one that I want to take today is Tej Madineni. Doctor, insomnia, does it refer to lack of sleep during night time or lack of sleep at all of any time of the day? Let's talk something about insomnia. What is insomnia, and when do you kind of have a problem with it?
So insomnia is something that it is a term which refers to lack of sleep or disordered sleep, to put it in the right way. So any type of problem with sleep which affects your day-to-day activities, there is no strict definition for insomnia that we have to stick to. But for practical purposes, what I call as insomnia is anything that affects any problem with sleep which affects your functions during the day. We can call it as insomnia. So almost everybody will have had a phase of insomnia during their life. So something that happens due to an acute event, for example, somebody, a close family member, something happening to them, that is something physiological. But what
Right.
we call as pathological insomnia is something which doesn't happen even without a proper valid reason. These are the things that we need to handle. And there are lots and lots of factors which are important when it comes to a good sleep at night, especially pain. Pain management should be done. And even more important will be controlling, in case of diabetics, control your sugar level. Bad sugar levels lead to insomnia. Bad blood pressure control can lead to insomnia. Bad cholesterol control can lead to insomnia. Your heart medications, your kidney medications, your blood pressure, like cholesterol, sugar, thyroid medications, everything are very important. All the medical conditions should be taken care of properly to lessen the chances of anybody going through insomnia.
Right, right. So that's the answer, Tej. Any questions? Please continue adding the questions with age and gender and probably other related issues or disorders or diseases. That will help. Like how Mr. Dasri David has typed all his details in one message. I request all the viewers to please type everything possible in one message. So next question is from Zaki Ahmed, and he works in a night shift and has been working in a night shift from past 5 years. How many hours do I need to sleep for good health? Also, how to get good sleep as I'm sleeping in the daytime. So let's understand that the generation is working in the night. Half of our population is working in the night. So what's wrong with sleeping in the day? And like the primitive brain, will it prevent from sleeping? Is that good quality sleep?
Yeah, the like going back to the analogy I gave, 99% of the time that human beings existed, if you are awake in the night and you go out in the night, obviously it means death. So that is what the primitive brain will always have. Have it in the back of its brain. So it will not allow you to work in the night properly. But then we, because of the circumstances, certain people, obviously everybody as a human society, everybody cannot expect to sleep in the night. Some people are there. Definitely there will be some compromise that you need to do. But the best thing that one thing that everybody needs to understand is sleeping in the night is in the day will never ever be equal to sleeping in the night time. That's something that people with night shift work have to understand. If and I tell all my patients to limit night shift work as possible. There is no way a 400-year-old brain is going to fight against a 2 lakh-year-old brain and win the war. That is never going to happen. But then again,
Wow.
given the circumstances that some people do have to do night shift work, my suggestion to them will be to limit the night shift work as much as possible and try to the ideal sleep time according to our brain is 10 p.m. to 6 a.m. That is the ideal sleep time. If you cannot sleep during that time, you have to do work. Obviously, try to get more sleep in the daytime. What I'll suggest is instead of fixing it at 8 hours, 8 hours is applicable only when you sleep in the night. If you want to sleep in the morning, what I'll suggest is sleep maybe for 10 hours or even more than that till you feel refreshed. And that way you try. And one more thing, several of my patients have this problem of constantly shifting duties, night shift one
Correct.
week and
Correct.
next day shift next week. That you tried, that is even more damaging compared to having continuous night shift works for maybe for 6 months or something. Because your brain, there is something known as a biological clock in your brain. It will try to adjust as much as possible. I know you should understand how difficult it is for us, for the brain to adjust the clock, which has been there for 2 lakh years just for you. It tries to adjust. It can adjust only very slowly. You cannot expect it to adjust every week once. This week night shift, next week morning shift. You try to avoid that sort of constant switching as much as possible. If you want to do a night shift work, my basic suggestion will be if you want to do a night shift work, and there are studies which have said which have clearly proven beyond point that night shift work is equal to a carcinogen. So it has
Wow.
proven, it has
So
been
that
proven
leaves
that.
me with a larger debate or a larger scope of policy making for the
Mm,
entire population's health. Maybe,
mm,
we should branch out
limit.
into people who are skilled people like you, experts like you, to sit down and say, boss, you are
Mm,
not, that's for a later discussion. But yes, this is a very, very important discussion. Ki who should work nights and why should we work nights? We'll take that
mm,
later.
mm,
But then, as you
mm,
suggested, that if you're sleeping in the day, please sleep for a longer time. So, sleep
mm,
hygiene, sleep routine, the day, the blocking of the light, having a good bed, silence, how much that
mm.
will affect us.
Definitely, sleep hygiene is a very, very important for a healthy sleep, healthy lifestyle. So my suggestion to everybody will be to your kitchen should close by 7:30 p.m. at night. 7:30 p.m. is the last anybody
One.
should be enter. Anybody should be allowed to enter the kitchen. 7:30 should be your last food intake. Maybe 8 o'clock, people who are taking tablets at night, maybe pressure, blood pressure medications, sugar or cholesterol medications, or somebody who may be on even sleep medications, you are allowed to take it up to 8 p.m. I have several of my patients who come and say that I take medications at 12:30, I get sleep only at 4 a.m. So that is basically fundamentally a mistake, the misunderstanding that is leading to that
Correct.
predicament.
Correct.
Your
Hmm.
sleep should start from 10 p.m. and you should be bed by 9 or 9:30. And this sort of routine, it should be done day in and day out, every day. There should be no excuse.
Yes, yes. Wonderful, sir. So, while we're talking about this, Jay Ganesh is asking an important question. I am not able to sleep in the night. Even if I sleep only for 2 hours and not more than that. Jay Ganesh, your age, it will be helpful if you can send in your age and any other disorders as well. I exercise and sweat almost for 90 minutes in the day. What else can I do to get at least 7 hours of good sleep? And I'm not in depression or stress, but still I'm not able to sleep.
Yeah, like I said, that primitive brain that we have is like a grandpa. Huh? Whatever it is, like a grandfatherly figure we can imagine. Whatever it wants, it will take it,
Yeah,
whether you
Jay
want
Ganesh
it
is
or not.
45-year-old.
Yeah. So whatever the sleep that the brain wants, what we call a sleep debt. If you don't sleep well in the night, the brain has a place to note it down. This person has slept only 6 hours today, 2 hours of sleep debt. Next day he's sleeping only for 4 hours, so it becomes 6 hours of sleep debt. So the brain will keep on noting it down. You don't worry about, like, you don't fix an amount of time and you don't tell your brain how much it should sleep. Go to sleep, go to bed. As I said, only thing you can control is when you can go to bed remaining. And many people ask me, I go to bed at 9 o'clock in the night, I sleep only at 3 a.m. So can I use that 6 hours for doing something productive? Can I use my laptop? Can I do some work? Things like that. That is something which is highly maladaptive. Don't do that. What I'm saying is 10 p.m. to 8 10 p.m. to 6 a.m. should be your bedtime, no matter what time you sleep. That is more than sufficient. And stop worrying about how many hours of sleep you get. As I said, a good sleep hygiene will help. Give a conducive environment for your brain to sleep. Switch off all the mobile phones. And one more important thing I have to say is, by 8 or 8:30 or 9, all your mobile phones, laptop, computer, TV, everything should be outside your room. I don't even suggest you have a clock inside your room, because many people have this habit of looking at the clock and getting even more nervous. So it has been 1 hour. I went to bed at 9 o'clock. Now it is 10. Oh, 9. Now it is 11. Now it is 12. They go into this stress panic. So please don't remove all the things which are going to suggest you how much time you've been in bed. If that leads to more and more anxiety, remove everything, put it outside. Give a conducive environment for your grandpa. He will take his own sleep. Whenever he wants, he will take the sleep from you. Don't worry about him. He will take it no matter what. Even if you're driving an airplane or driving a truck, he will take it from you.
Right. So, being a 45-year-old, Jaideep, I think I understand that though you're not stressed, though you're not anxious, I think it's a routine that we need to formulate and not count the number of hours, is what Dr. Somasundaram has
It is
suggested.
better not to
So
talk.
here
Yes.
I'm placing two questions from two different age groups, is what I'm assuming. Prashant Yaraguntla, it will be helpful if you can type your age as well. Here's Dasari David, who is a 66-year-old, hypertension and diabetes in managed. Both of them are managed, but at times my brain gets activated in the night, thinking about what all has happened in the day and also about the tasks in the near future, etc. And I don't sleep at all. Please advise. And Prashant, I'm waiting for the age group as well. I sleep too much, or I don't sleep at all during night. I think more in the night and than the day. How do I resolve? So this excessive thinking in the night, once you think that you are about to sleep, that's when all the thoughts come in. How do we control this?
Yeah, it is better to do all the thinking in the daytime. Nighttime is something where we have to calm our. It is easier said than done. It is like there is a story where the king was given a medicine, and whenever you think of mangoes, this medicine will not work. But obviously, every day when he wanted to take that medicine, he was thinking of mangoes, and obviously the medicine did not work. Somebody tricked him. So it is like that. It is like asking you not to think and have a like calm mind. That itself makes some people to think too much. So now I'm thinking this, I'm thinking that. Oh, I should not think. My doctor told no. My suggestion will be to just go to bed and have a blank mind as much as possible. Don't carry your worries to a bed. A bedroom should be sterile. It should be away from your worries. It should be a place where you look forward to going in the night. Make it pleasant. Make it a pleasant place to go. Like, avoid all the influences as much as possible, which are going to remind you of your day-to-day stresses. You have 16 hours to worry in the morning. Don't carry it to your bed, and don't do a lot of calculations about. Don't worry about your finances. And this is why I say the bedroom should be sterile. Like, don't ever have this habit of taking your work to the bed, because every time you go to your bed, all you think about is work and stress. Don't program your brain into thinking that the bedroom is the place where you do most of your work. I've seen many IT professionals have this problem. They take their laptop to their bed and work and work and work. So whenever they go to their bed, their brain automatically goes into work mode. It starts stressing. It starts thinking about the finances. Keep everything outside the room. Let everything be restricted to the your work and study. Everything let it be in your office or in your study room. Nothing should be in your bedroom. Not even a TV. that we see this trend picking up where every bedroom has a TV now. Keep everything outside. We don't want these influences. Yes, it should be a very good place for the grandpa, the primitive brain, to have a good nap. And if you give it to him,
And
he will
while,
thank you.
yeah, while you're saying about this, Dasri David ji has replied saying, habituated to finish my dinner by 7 p.m., followed by
Very good.
medications. I stop
Very good.
mobile, I keep it in other room, but still I'm unable to sleep.
No, as I said, the brain is
He's
a very
66
stubborn.
year old.
Yes.
Yeah. He's 66
Yeah.
year old.
Yeah. The brain,
So
as
it
I
must be
said, is
also
a very.
the training from the past years. Does that also have an
Yeah.
effect, doctor?
The brain is a very, very stubborn organ. It will take its sleep. I will say, just your job is to go to bed at 9 or 9:30, and don't worry about how many hours of sleep you get every night. Just be in bed, close your eyes, don't think of anything. 9 p.m. to 6 a.m. every day. That itself is more than sufficient. Your brain will thank you for the years to come. 66 right now has become a very young age. Everybody lives up to 1995.
Mm,
For the next 30
yeah.
years, your brain, mind, and body will thank you just for going to bed. Control things what you can control, what things you carry to bed, what time you go to bed. These things are things that you can control. Do it, but don't worry about how much sleep you get, how much sleep you got last night. And we have a lot of these apps which calculate and keep on reminding
Yeah, they
you how
monitor.
many hours of sleep you get. Please don't do that also, because the brain knows what it wants. As I said, even when you are piloting a flight, it will take its sleep. Even in the most inappropriate of times, it will take its sleep when it wants. So don't worry. Just give it a conducive environment in the night time. It will take its own sleep. Don't worry about how much sleep your brain gets. Let the primitive brain worry about that.
Yes, sir. So next question that I wanted to ask, Dinesh is asking the same question here. Do aged people find it difficult to sleep? Because my parents hardly get any sleep in the night. Is there any solution for these elderly?
uh, like the younger people's, the neonates, newly born babies, you see that they sleep almost for 12 hours to 18 hours in a day. So the brain also, as it matures, as it becomes older and older, the number of hours of sleep the brain requires itself comes down. So that is why physiologically older people, in fact, need a lot lesser sleep time compared to older people. That doesn't mean that you can do something in the night. You cannot do some. I'm 70 years old. Can I do some work so that that the 10 p.m. to 6 a.m. sleep time is fixed for everybody. Bedtime. Go to bed at 10 p.m. and wake up at get up at 6 a.m. No matter how many hours of sleep you get. But definitely older people definitely get a lot less sleep compared to the younger people. It is not a disease or something. It automatically means that your brain requires a lot lesser sleep, because the learning part, the more the brain learns in the younger age, the more the sleep it wants, because there is something known as consolidation. I don't want to go into memory and things like that. So the sleep requirement of the brain, as I said, the brain knows how much sleep it requires. The
Correct.
more information that is it has to consolidate, the more the sleep it needs. And a young developing brain needs more repair work and more consolidation work to be done in the sleep time. So it needs more sleep. The brain takes more sleep from an infant, but it doesn't need that much sleep in the elderly people, because you've learned everything.
Right, right. So elderly, if they're not able to sleep much, don't think that it is a sleep
Mm.
disorder. So they have minimum amount of sleep time. If they are well rested, we should leave them the way that they are. Right. So next is Shamla's question. Gurla Shamla. So my husband is a diabetic patient and he has undergone a foot amputation, unable to sleep for months due to pain, in spite of painkillers. So any respite from this?
Definitely, pain is something which we have to like address as early as possible, because pain is a stimulus which will stay for a long time. You would have seen people wearing a spectacle and searching for the spectacle everywhere. You would have
Um,
seen people wearing the specs and searching for it everywhere,
correct.
not knowing that it is there, because touch sensation is something which is a rapidly adapting response. What the brain as you keep touching, as the specs keep touching your face, the brain slowly starts forgetting the touch sensation, so that it doesn't, even if you are having a specs, the brain will not bother it. But pain is not it's not a rapidly adapting response. As long as the pain stimulus is there, the brain will feel it every second. So in
Wow.
that environment, like you can like I am wearing a shirt now, but I'm not aware consciously that there is a shirt now. It is touching my skin, but I'm not constantly aware that there is a touch sensation. But pain is not something like that. As long as the sensation is there, you will feel the intensity throughout. So pain is something which will not allow you to sleep. Try to get rid of the pain as much as there. A lot of medications are there. Definitely, it is very rare to find a patient who does not respond to any of the pain medications. Very rare. Maybe one in 10,000 patients have such problems, but it is very rare. But as long as you are having pain, don't take the shortcut of taking more and more of sleeping pills. That is not going to help you. Try to address the
Right.
pain more. There are definitely, I assure you that there is going to be a good combination which is going to work for your pain. Find that combination, and that will help you sleep better. Not taking the shortcut of taking more and more of sleeping pills.
Okay, so we will come to the point of taking some supplements or pills for sleep. I'll come back to that question later. But in continuation with not able to sleep well due to other reasons, here's Amar Jakka's question, or not able to sleep really well. I get up when even a small sound occurs, or even a bed light gets switched off during the night. Is this a problem? And also something similar, here's Rekha's question. Rekha says she got operated and removed gallstones were operated on. She's lost weight, 10 kilos of weight, body weight, and since then she's unable to sleep deeply. Every 2 hours she's waking up. So waking up, unable to sleep really very well. What are the phases of sleep, and why is this that we are waking up at a very slightest of a disturbance?
Yeah, when something relevant to the question that we discussed earlier, a point that should be brought in right now is when it comes to sleep hygiene. It doesn't only involve you going to bed at 10 p.m. That the bedtime between 10 p.m. to 6 a.m. I said, as a corollary, that also means that 6 a.m. to 10 p.m. is no bedtime. Please avoid the temptation to go to sleep in the afternoons, in the evening times. So that is very important to get a deeper sleep at night. There are 5 different stages of sleep: NREM, stage 1, stage 2, stage 3, stage 4, and REM sleep. And these cycles happen in a gradual fashion as you sleep in the night time. But what happens is if you have a disrupted sleep, that can be because of you sleeping in the afternoon or in the evening, you don't transition through these stages properly. You go from stage, obviously, every sleep starts from NREM, what we call as non rapid eye movement sleep. We don't want to get too technical because practically
Yeah.
those things are not very important. But we transition from NREM stage 1, 2, 3, 4, and go to REM sleep. What happens when you sleep in the afternoon or in the evening? You don't reach the depths of your sleep. You don't go to REM sleep and NREM stage 4 very often. NREM stage 4 is the deepest sleep along with the REM sleep. That is the most refreshing part of your sleep, and that is also the most rewarding part of your sleep. As something like the older people also lack a lot of NREM stage 4 sleep. That is also one of the reasons why they don't feel refreshed more like younger people. But you sleep in the afternoon, or you sleep in the evening, or you take something like caffeine in the evening time, or tea in the evening time, or chocolates in the evening time. These are all going to affect the depth that you reach in the night time. So my
Okay.
suggestion is maintain a good bedtime, and other times, that is 10 p.m. to 6 a.m. bedtime, 6 a.m. to 10 p.m. Avoid the temptation of going to bed and sleeping. And even if you want to take a nap in the afternoon, you feel very tired, very exhausted, mentally exhausted. Maximum 20 to 30 minutes, not more than that. If you sleep more than that, obviously that is going to affect the quality of your sleep in the night time. It is going to affect the depths of your sleep, and even the slightest of the disturbances will wake you up.
Right. So somebody was asking me about day sleep. I think that our question is already answered here. So while we're talking about the stages of sleep, the 5 stages of sleep, there was an app which, unfortunately, I was wearing a smartwatch for a while, which was monitoring all of these parameters of oxygen. sleep and all. So it was suggesting your REM sleep was this much, it was NREM sleep was this much. So I really got anxious. I found that I was delving too much into the details. Who requires this and who doesn't require it? So there is a question about sleep study was asking, Debraj Datta is asking about what is a sleep study and why does, my personal question is, why does one require a sleep study? And his question was, does Apollo do sleep studies at home? So who requires it first, point, sir?
No, the thing is, not everybody with a sleep problem requires a sleep study. So that is something that everybody needs to understand. And sleep study in certain people will increase their anxiety, knowing how much REM sleep you get, how much NREM sleep is going
I
that you
went
get.
into that and I
Yeah,
said,
I think
"Mujhe
it is.
smartwatch nahi pehenni hai, boss."
Unfortunately, that is not going to help you. That is not going to make you like sleep better. Like it is better left to these things just because our technology is advancing. There are a lot of things that are coming up. Everybody slowly, there is going to be a day that everybody has an operation theater in their home. Our technology advance will be that much. That doesn't mean that everybody can do their own surgeries. Like so, it is something that is better left to professionals. What is REM sleep? What is NREM sleep? When you need them, it is better your doctor decides depending on. There are specific situations like narcolepsy, obstructive sleep apnea, hypopnea syndrome. These there are specific situations where the doctor needs to get these information to help you. And
Yeah.
I don't understand how you yourself can help you knowing how much percentage of NREM sleep you get, how much REM sleep you get. That comes back to the analogy of a 500-year-old trying to control a 2 lakh-year-old person. Nothing. That is not going to happen.
Right. And then maybe, we should have controls over who's creating this for whose, technology advancements. Then I need to get a 5-year medical degree to understand all of these as well. Yeah. So continuing the questions, doctor, ambience का बारे में सौरभ भट्टाचार्य जी, yes, doctor has already given an answer, so we can go back. Yes, the recording is available, ma'am. You can continue watching this after the live as well. If you have any question, we'll take up in the live. This is Disha Khattar. Doctor, suddenly since 2 weeks, I'm unable to sleep in the night or day. I had a viral infection, took some medications. Ever since I stopped the medication, I am unable to sleep well. So, any acute or short-term reasons also which cause insomnia?
Yeah, what happens is many of the viral fevers we tend to see patients who have been prescribed antihistamines, and these medications will promote sleep as long as you take them. And whenever, especially cold medications, cough medications, diphenhydramine, antihistamines, these sorts of medications have sleep-inducing properties. So whenever you like take these medications, your sleep is better. That is why when you take any cough syrup or any cold tablets, you feel drowsy all the time. But when you get better and when you stop these medications, there will be a transient period where your brain expects these sleeping influences to come in and kick in. But obviously, that is not going to happen because your cough and cold is over. So, for the brain to adapt to the lack of the sleep stimulus that you have been using, it will take some 2 or 3 weeks' time. I will not. It is going to be a transient thing. It is like a passing cloud. Don't worry too much about it. Just because of taking
Yeah.
some cold medications or some viral infection medications, you are going to not be become an insomniac for the years to come. It is going to be maximum for 1 or 2 weeks or maybe a month. That's all.
That's it. Yes. So there are two questions, Mr. Chauhan and somebody else. Napping के बारे में. Day nap, is it okay to take a nap in the day?
Yeah, nap, as I said, it should be restricted. My suggestion will be maximum it cannot cross more than 1 hour. 30 minutes is the sweet spot. 20 to 30 minutes, what we call as power nap. 20 to 30 minutes is the sweet spot. Don't do more than that. Especially don't do that in the evening. It can be done in the naps can be done in the afternoon. Maybe get it done before 2 or 3 p.m. Anything beyond that, you are definitely going to affect the quality of your nighttime sleep, and that will in turn make you want to sleep more in the afternoon the next day. So this will become a very ominous cycle, which is going to spiral out of
Correct.
control, and you will one day require a sleeping pill.
Yeah. So now, anyway, we've talked about sleeping pills. So let me ask this question. Mr. David is asking: is an occasional sleeping tablet okay if I am disturbed? What are sleeping pills? First point. What do they do to you, and who should be advised on a sleeping pill? And only on advice. It's not a OTC, right? So, what's the role of a sleeping pill first?
Sleeping pills have their specific role in medicine. Sleeping pills are I won't say they are bad or good, but they are a very powerful tool that used properly they are like a boon to people. And it is like a powerful tool. It's like a knife. You can do anything. You can do a surgery with a knife, or you can murder with a knife as well. So sleeping pills are very powerful. They are as powerful as knives or guns. It should be used properly. And there are only very specific indications where people really need sleeping pills. It is not for everybody. Everybody comes into the clinic asking for, I don't sleep well at night. I cannot immediately prescribe a sleeping pill for their own good. Obviously, sleeping pills are addicting, they are habit forming, and many of the sleeping pills work almost similar to alcohol. So, my suggestion will be not to fall into the trap of thinking that all the sleep problems are getting better with sleeping pills. Especially, there is a condition known as obstructive sleep apnea. Many people suffer from that, and if you take sleeping pills for lack of sleep, that is going to make your sleep even worse. So there are specific
Right.
conditions where sleeping pills can make your sleep worse. So it should be done in a very
Right.
proper way, and obviously your neurologist will know better. If you want a sleeping pill, just go and request it to your neurologist. Let him assess what type of sleeping problem you are having, and depending on that,
Correct.
he can suggest it.
Right. So next question is about the supplements. Okay. So sleeping supplements, something like Hufeza Kazi, who is 48-year-old male. I go to bed around 10:30 p.m., but I'm unable to sleep till late midnight. Sometime even till 2 or 3, I'm unable to sleep. Sometimes I take melatonin, but that does not help. And somebody else was asking, be like, इनका नाम and age नहीं है. Do supplements like ashwagandha help for good sleep without any side effects? So, what about these supplements and other hormones?
Uh, Melatonin, like as you said, it is a natural hormone which we use in specific situations for them to get entrained to sleeping better. They have specific indications. Even melatonin, I see like lot of prescriptions with melatonin. It also has a specific role, and if not used properly, it can even harm you. So melatonin
Oh,
we give to patients who have a jet lag, people who have a transient problem in adjusting to the new rhythm. The people who would have worked in US for 2 or 3 years, American time, now they can come to India, that sleep night cycle is getting disturbed. For them to adjust to that, the hormone that is required is melatonin. So for them to adjust to that, we give melatonin. It is not for everybody. That is the crux that you need to understand. And regarding the supplements, there are no approved supplements for you to sleep better. Like I said, like what you need to do is maintain a sleep hygiene. My suggestion will be not to take any sleeping pill. And regarding supplements, I'm not too sure whether supplements really do work. And but if it psychologically makes you sleep better, you can. There is nothing preventing you from
you know
taking them
these
as long as.
घर के नुस्खे, the tips that you see: have a glass of warm milk before you sleep, apply warm ghee on your feet. You know,
Yeah,
these are
regarding
things that.
food, Yeah, regarding
Yes.
food, they have a role. Regarding food, you see, there are certain foods that you should not take during dinner. That is very important. You should avoid spicy food, obviously. You should avoid a bulky or a fatty meal, lot of cheeseburgers and pastas, junk foods, chips. These sorts of things will keep you awake at night. Especially, definitely, there is no need to talk about coffee and tea. Coffee and tea should be avoided anytime near your sleep time. That is very important.
Right.
Definitely, no alcohol, no smoking, even chocolate, dark chocolate. These are substances which will keep you awake at night. When it comes to the other
Yeah.
side, what are the food items which helps you sleep better? Definitely, as you said, a glass of warm milk, nuts, almond milk, nuts, and vegetables, lot and lot of green leafy vegetables, bland diet, more and more of water, more vegetables, less spice, less oil, and taking even yogurt, curd, milk and milk products. These tend to make your sleep better. And there
Right.
are foods like chocolate and coffee, tea, and alcohol, which will definitely affect your sleep. These things you should avoid.
Wonderful. So here's a question from Jay Kumarji, who's 70-year-old. I'm waking up in the middle of the night. Is that a disorder? And who should I consult? Very important question here. Because if
Yes.
there is a sleep disorder or a pattern that you're unable to make or break, especially around sleep and hygiene, who do we go and consult? We don't even know who's a specialist to consult.
So what I'll suggest is that I saw a very interesting article that a few centuries ago, we used to sleep as human beings. We used to sleep in two phases. We used to start sleep at 5 p.m. Wake up at around 12, especially in the Western countries. Wake up at around 10 or 11, then do some work in the 3 hours, and then sleep for next 4 or 5 hours. We used to be biphasic sleep creatures. That is what that particular article said. Whether it needs further research. So each and every one of us have our own sleeping style. As I said, we all have a grandpa living in our brain. He has his own way of sleeping. He wants whenever he wants, he will sleep. But my suggestion is, even if you wake up in the night, that is why I said remove all the cues that you have in your bedroom, like taking a mobile and seeing. You wake up at 2 a.m. Avoid the temptation to resist the temptation to take your mobile and see even the time. Please don't do that. That light is enough to disturb the rest of your sleep. Especially if you open the app and then look at some doom news there and look at who's messaging you and who has seen your status, and it is going to lead to more and more why this person has not seen, why he has not commented this stats. So it is better to avoid all. I will suggest you to even remove the clock from your room. You get up from
Yeah,
your sleep at night 2 a.m., just close your eyes and lie in your bed. Don't do anything. Maybe if you want to go
correct.
to your restroom and come relieve yourself and come. Other than that, nothing, no light, nothing should be allowed to disturb you.
Wonderfully explained, doctor. Here's another question about stress. Praveen Kumar is asking, due to work stress, sleep gets affected. Also during sleep, many times work concerns keep running in my subconscious mind. How do I avoid it? And also somebody else was asking about her, she has family issues and she's depressed and she's unable to sleep. Two different reasons, but both of them are affecting the sleep quality.
Stress is something like akin to the whatever the stress that our body faces. We always go into this flight or fight mode, irrespective of what the stressor is. The body always goes into a survival mode. It tries to save itself. So in that mode, it is very difficult for us to get a good sleep. So whenever you are stressed, whether it is psychological stress or physical stress, somebody was mentioning about pain, chronic illness, whatever the stressor is, there are a lot of hormones that secrete in your body, which go into a flight or fight response. Like as I said, our primitive instinct brain kicks in. We go into survival mode. Whenever we are worried about our life, it is very difficult for us to sleep, because if
Correct.
you sleep when there is an impending danger, obviously we know what will happen. When we were living in caves, now we have the luxury of living in a bedroom and having we can forget there is about the stress that is going to come and kill us. But unfortunately, that is how that survival mode the brain goes into will prevent you from getting a good sleep. My suggestion will be in people who have anxiety and stress and depression. As I said, instead of going into more and more of sleeping pills, try to sort out these things. Meet a good neurologist or a good psychologist, psychiatrist, get some counseling done, get that sorted out. Pass, like, nothing is permanent, right? It is going to be something which is going to be transient. You are going to move on. Until that, your sleep is going to be affected. My suggestion is not to go more and more into sleeping pills and becoming addicted and starting one more new problem in already to the problems that already your mind has, like depression. So it is better to sort out the depression causing problems, causing depression, fix that problems causing anxiety, try to fix that. If you cannot fix it on your own, try to get professional help from a neurologist or a psychologist. Get that sorted out. Your sleep will take care of its own.
करेक्ट करेक्ट सो अंडरलाइन स्ट्रेस को पहले टैकल करो उसके बाद में स्लीप को टैकल करेंगे अपने आप
Yeah.
so that's the answer and here's a quick I know it's not the topic for the day but we would want to talk about sleep apnea and snoring as well one quick because I have very less time 2 or 3 minutes to wrap up so if you can quickly talk about sleep apnea and snoring as well.
Yeah, sleep apnea is becoming more and more common nowadays because of what we call as a metabolic syndrome. Everybody is overweight and obese, and thanks to the junk foods and culture that we have, and thanks to eating whenever we want, eating in the night, whatever time we want, all these things do add up to obstructive sleep apnea. The more and what there are studies which prove that the thicker that your neck is, the more and more chance of you having a sleep apnea. The more fat you have in the neck, the more and more chances of you have going into sleep apnea. What happens is when you sleep, all the muscles around your neck start to relax, and all the weight that is being put on your respiratory tract by the fat and the extra additional layer of tissue that hangs in front of your neck, they tend to fall back, including your tongue, a fat tongue or a fat neck. They tend to fall back and obstruct your airways. So that leads to a lot of sleep disturbances. And paradoxically, these are the patients who get worse with sleep medications. Very important for you to understand. You take more and more of sleep medications, the more and more of these tissues become lax, the more and more these airways get blocked. So paradoxically, these patients don't do well with sleep medications. So, and the best thing to do for obstructive sleep apnea is always a good lifestyle. Control your food, control your diet, control your weight, get good exercise, and especially definitely coffee, tea, and alcohol have a major role to play in obstructive sleep apnea as well. The more and more of alcohol and coffee and tea you take, the more and more chance of you having an obstructive sleep apnea, and that needs a and beyond a certain point, obstructive sleep apnea needs a professional help like positive airway pressure. There are lots of devices available, and definitely if you have OS, that is obstructive sleep apnea hypopnea syndrome, if you have that, there are good modes of treatment available, and please seek professional help. Don't look into the internet and do something on your own. It is better to seek professional help. It is fully treatable and nothing to worry us.
Yeah,
Nothing to worry.
I can promise that very shortly we shall take up sleep apnea as a separate subject and talk about it in depth more. So let's start. For now, I think that's a brief introduction to it. So here's Hazik Hassan, 22-year-old, and I cannot sleep whole night. And I don't have depression. I'm not any anxiety disorder, and I want to know what's the reason behind it. So here's a 22-year-old. My daughter is also 22-year-old. The entire generation I see are working till 2:33 in the night, and they have these habit of being connected. All the grandpas in their what do we tell the younger generation? How do we tackle
Yeah,
this?
they have to be like as with every other problem that we come across. The first and foremost step to all the patients is not pills. It is always education. You need to understand, like people who have joined late, please look at the earlier part of this video. You need to understand how sleep functions. Like you cannot ask your brain to sleep whenever you want. Like what you can control is what time you can go to bed, what time you can wake up, what things are allowed in your bedroom, what things that are not allowed in your bedroom. These are the things you can control. And your brain, let me tell you again and again, it will take care of its own sleep. You give it its time, you give the respect to your older part of your brain, it will take the amount of sleep that it wants. Just be in bed from 10 p.m. to 6 a.m. every night. Don't worry about how much sleep you get. Don't use these apps and things like that. That is only going to make your life even more difficult. That is going to increase your stress levels. Get rid of these things. Go to bed 10 p.m. to 6 a.m. every day, no exception. That is more than sufficient. Your brain will thank you. Don't worry.
Yes, so with that, I think the larger discussion is still pending of, the technology, the advancements, the kind of work that we do, the children, the students who are put to pressure of studying in the nights, all of these, the performance anxieties, everything needs to be addressed. It's not just how we maintain our hygiene at home. Larger discussion pending. But last question I would want to close is, how can I sleep 10 minutes after I get into my bed? This was a registered user's question.
So as I said, like please, uh, that there is nothing that you can do to make your brain sleep 10 minutes from the time you go to bed. As I said, please don't have the habit of counting number of minutes that has passed since you've gone to bed. That is only going to make you more and more anxious. As I keep telling again and again, you can control what time you can go to bed. It is better your brain decides when it wants to sleep. It will. Don't worry about your brain. It will take, just give it a conducive environment, give it a sterile environment to sleep. It will take the amount of sleep that it needs and forget about it.
Okay. Correct. So, quickly, doctor, beauty sleep, is that a myth? Is there a connection between sleep and skin? While I also want to note down one of my very close family member who's a very young, under 30-year-old who does not sleep really very well. she was diagnosed with other hormonal issues like PCOD and thyroid. So is there a connection?
No, sleep affects, like one thing I want to re-emphasize and emphasize is that sleep affects every organ in the body from your hair to your toenails. It affects all the organs, and skin is no exception. It affects your heart, it affects your lungs, it affects your gut, it affects your skin. Obviously, if you want a good skin, you need a good sleep.
Correct, correct. So that's wonderful. So it has an effect on every organ, including your skin and
Yes.
other. Yes. So, well, I can't take other neurological questions here because today's episode is dedicated to sleep. I know that we have a very senior neurologist there, but you can consult him on Apollo 24/7, and we are going to leave the link to consult Dr. A.C. Somasundaram there. So, Doctor, we have come to the end of our question answer session from our audience, but I would want you to give us some top tips to take care of our sleep hygiene, how to sleep faster and better.
Yeah, my suggestion to everybody who has tuned in is please give the respect to the sleep hygiene. Please give the respect, because what time you go to bed, what time you wake up, as I kept telling again and again, that should be the take home message of this session. Everybody should respect your mind, respect your brain, and respect your body. Everything comes second to that, your social media, your work, everything. Go to bed at 10 p.m., not a minute late. 10 p.m. should be your bedtime, and wake up at 6 a.m., irrespective of what time you get out from your sleep. Even if you get out at 3 a.m. or 4 a.m., please go back immediately. Don't think of anything at that time. Don't use that time for doing something. And restrict all stressful and keep all the stressful activities out of your bedroom. Don't make your bedroom into a stressful place. And have all the arguments and stressful, everything should be outside your that should happen outside your bedroom. Your bedroom should be made conducive to sleep. Next important thing is your kitchen should close by 7:30. Nothing should be taken after 7:30 p.m. That is what also going to help you sleep better. And what food you take in the night, take more and more of milk, vegetables, and bland food. Less and less of spices, cheese, oily foods, pizzas, and fast foods. More and more of healthy food in the night. That is going to help you sleep far better. And avoid coffee, tea, alcohol, especially alcohol, and smoking as well. These are all going to affect your sleep. And last but not least, have a healthy weight, have a healthy diet, maintain your weight, and definitely that is going to help you get rid of all the other type of sleep disorders that we'll be discussing in the future, called obstructive sleep apnea as well.
Wonderful, wonderful. So thank you so much, Doctor. It was a very important session that we take care of our sleep for better society as well. Namaskar, and we appreciate your time on Sunday morning.
Thank you so much for giving me this opportunity. It's always a pleasure.
Thank you, sir. So that was Dr. A.C. Somasundaram answering your questions, and now it's your time to answer our questions. Health quiz coming up. You must be watching this on Instagram and Facebook as well. But I'm going to ask you 3 questions now. Please answer on YouTube chat only, and winner's name will be announced towards the end of the show. If I take your name to be the winner, you have to email with all your contact details to marketing@apollo247.com. Winners will be selected at the sole discretion of Apollo 24/7 team. Gift vouchers will be shared with you, provided you give us all the correct details before Wednesday every week. Here are the 3 questions for this week on the screen. The first question, true or false? Regular physical activity can promote better sleep. Is that true or false? I repeat the question. Regular physical activity can promote better sleep. True or false? Question number 2, fill in the blank. Sleep occurs in how many stages? Dash stages. Number of stages, please fill in the blank. Sleep occurs in dash stages. It's just a number. If you have followed the show, it's easy to answer these questions. Question number 3, yes or no mein answer kijiye. Poor sleep has immediate negative effects on your hormones. Yes or no? I repeat the question number 3. Poor sleep has immediate negative effects on your hormones. So keep your answers coming in, and in the meanwhile, let me give you gift coupons that you can use on Apollo 24/7. The first one that you can use is ASKBOC150 Ask Doc 150. This is a coupon where you can consult doctors from direct from Apollo. Get 150 rupees cash back on online doctor consultation. The next one that we're giving away today is FIRST 3, FIRST 3. Get 25% off on online medicine orders when you order medicines direct from Apollo hospitals. And the last one that we have for you today is exclusively for Health Hour viewers. Use the code HH247, get $199 off on online doctor consultation with Apollo doctors and up to 20% off on medicine orders. Well, the ordering is not just on the app. You can now do it on WhatsApp as well. If you're looking for medicines, we are just a call away. Call or WhatsApp on 9355247247 to avail healthcare services. And next week, by the way, we are talking about how to protect your skin this Holi. Holi is just around next week. We're going to have a great festival this year. Of course, we are all taking part in a greater celebration. But while we are celebrating Holi, there is a risk for your skin damage. How do you protect your skin? And what are the side effects of playing with chemicals? All of this we are going to talk about. On 24th March, 11 a.m. we are going to talk about it. Let me see who's all participating in the quiz. All right, Simranjit Singh, Sumitra Devanand, Harminder Kaur, Health, Hope, Happiness. Okay, a lot of people are answering the questions. Yes, I think our team is going to have a tough time selecting the winners this week. I think we don't have right answers. Not many are right answers for question number 2. Let's see who our team selects right now. I'm waiting for the winners to be declared. Okay. Well, we are running short of time. I shall wait for the team to send me the winners. In case that we do not find a winner for this week, we will be leaving the winner's name in the chat box, and then the winners, you will have to write back to us to claim your prizes. Well, I'm giving you all a clue that question number 2, a lot of you are answering stage, but our doctor today has given a different answer. So we are looking for the answer which matches our expert's answer. So please go ahead, check the chat earlier, or remember what doctor has said. All right. I see some people have changed their answers as well. So, all right. So I think we will close the session today. I will wait for the team to send winners on the YouTube chat. Your winners, you will be selected and put up on the YouTube chat. Please do write back to us to claim your prizes. So for today, we are going to sign off. Thank you so much for joining us, and we shall see you next week. Namaskar.